Hi everyone, Juanita here. I'm a doctor of physical therapy and the owner of Athena Pelvic Therapy. Today we're going to be talking about trigger points. But in order to understand trigger points, you first need to know how a muscle is composed. A muscle is actually a bunch of little teeny tiny muscles that we call fibrils. Now those fibrils contract and expand just like a rubber band. And that's why your muscles are able to move your bones around, is because they contract a bunch of those fibrils and then they also relax those fibrils. And that's really all that a muscle does. It just contracts and relaxes. Now, a trigger point is an area in the muscle that a few of those fibrils are contracted, and it can be very tender and very painful. So not only is it tender or painful, but it also can hinder the way that your muscles function. So if you are experiencing pain in your pelvic floor, this is pain with intercourse, just general pain with going to the bathroom. If you're having any kind of pain, there's a pretty high likelihood that you have some trigger points that are contributing to that pain. And generally, a pelvic floor physical therapist will get in there and they will release those trigger points, or they'll show you how to do that. Now, not only do trigger points contribute to pain, but they also contribute to the dysfunction of the pelvic floor, meaning that the muscles do not work the way that they should. And that's because instead of contracting and relaxing like normally they should do, they're kind of stuck in this contracted state. So they're shortened. And just because something's shortened doesn't mean that it's stronger, which is kind of a misconception when it comes to generally muscles. So even though something is contracted, maybe you have lots and lots of trigger points, it doesn't necessarily mean that your pelvic floor is stronger. In fact, it's probably weaker because it's not doing what it's supposed to do. So that's a little bit about trigger points. Be aware of that if you go to pelvic floor physical therapy, or if you have me come and visit you. Know that trigger points is something that we look for to make sure that the muscles are functioning properly down in that pelvic floor. Again, if you have any questions, make sure you give us a call here at Athena Pelvic Therapy. Have a great day.